Good evening, everyone. Thank you so much for taking our time and joining this session. Today's topic of discussion is healthcare marketing strategies for growth. I would like to now introduce our esteemed panelist. First up, we have Mr. Ashish Anand, Vice President Digital Growth and Marketing, CK Birla Hospitals, and I am Calcutta graduate with a global expertise across India, Europe, and US. Ashish specializes in setting up consumer tech platforms and growth engines for digital-first organizations. At CK Birla Hospitals, he's redefining patient acquisition experience through advanced analytics, performance marketing, and digital transformation strategies. Thank you so much for joining, sir. Next up, we have Dr. Suman Dey, Vice President Marketing and Business Development, Charnock Hospital. With over 25 years in healthcare and pharmaceuticals, Dr. Dey brings a wealth of expertise in sales, marketing, and business development. Having worked with Cipla, Evolt, Eris Life Sciences, and Cairo Banks, he now spearheads Charnock Hospital's marketing initiatives while serving as an advisor to multiple healthcare organizations globally. Next up, we have Mr. Azmat, Marketing Director, Tricog Health. With years of experience in healthcare marketing, he has been instrumental in building scalable marketing systems that fuel revenue growth. At Tricog Health, he focuses on leveraging digital platforms and data to bring life-saving cardiac diagnostics to millions across India. Moderating this session, we have Mr. Sridhar Sampath, Vice President of Marketing and Strategy Lead Square. With over 2 decades of experience leading customer teams and partners across industries, Sridhar excels in building high-impact businesses functions from the ground up. Skilled in marketing entry, GTM strategy, and partner management, he has a proven track record of driving growth through cross-functional leadership, new client acquisition, and strategic negotiation. Thank you so much to all our panelists for taking our time and joining this session. I would like to also welcome our audience. Hope you find this session extremely insightful. Please feel to drop in any questions that you have. Our panelists will take up the questions towards the end of the session. Over to you, Sridhar.
Okay, thank you so much, Ashna. And again, good evening, Ashish. Good evening, Azmat. Good evening, Dr. Dey. Though I don't see him, it looks like he's dropped off. Ashna, maybe you want to ping him and get him back online. Great to have you all here. Thank you so much for accepting the webinar invite, and good to see you all here. Yeah, so I think we're talking today about a very interesting topic. I think healthcare, as we all know, has been in the news for a long time in this country. It's one of the fundamental sectors in the economy today, along with roti, kapda, makan. Dava is certainly the next one. There is a certainty to the growth of the sector. There is, because of the large population that India has, because of the demographic trend that India has today with a reasonably young population today, which is probably aging over the next 30 years, the sector probably will only see a lot of growth as we go ahead, right? So one thing that is for sure about the segment is that there is growth which is anticipated, which brings with it its own set of problems. It's great to be a part of an industry which is growing, which also means everybody's attention is on the industry. Everybody's trying to see what they can do in the space, right? So one question that I wanted to start off and kick off this conversation with was that sorry. Did I drop there for a minute? I'm sorry.
So we can hear you, Sridhar. Go ahead.
Okay, cool. Sorry. Yeah. So one question I was wanted to start off with was that over the last 12 months, given the situation where there is always going to be demand in the healthcare space, what sources as marketers do you look at as being the primary demand source for your respective industries? The three of you come from very interesting segments. One is from a super specialty hospital. The other is from a large group of organizations, which also includes healthcare. And Azmat, you are from a medical device organization. So what has become your highest demand source over the last 12 months? And what is it that you have stopped focusing on? Maybe we can kick off the discussion from that. Ashish, do you want to take this first?
Yeah, so our demand source typically has been digital media over the last not just 12 months, but over the last few years. And the behavior of users before landing to a healthcare or a hospital setup is basically they would go research online, read about us, because healthcare is a very informational category. So which is where knowing more about the disease, ailment, or the doctor before actually landing to the hospital becomes very important. And then it is also about how we have been able to disseminate that information to our user sets. One, of course, is through our Google search engine platform. And once we have their PII data, have we been able to engage with them well, to be able to make a mark and to be able to talk about our clinical excellence to be able to make it more personalized for them. So this has been the trend overall over last not just 12 months, but I would say 24 to 36 months. But over the period of last 12 months, the bet on the personalized experience has even gone deeper and become more important for them. And it has become an important factor in the decision-making journey of the user while choosing a healthcare provider.
Okay, got it. Great. Thanks, Ashish. Dr. Day, would you like to chip in with your point of view on demand source? And maybe you can talk a little bit about how you're balancing website versus aggregators versus referrals, etc.
Yeah, I do agree with Mr. Ashish that website and the online platforms have nowadays are there playing a major role. But in addition to that, healthcare from my end, it will always be a referral-driven game,
Mm-hmm.
especially once you go out of the urban segment, because healthcare will have reach in both urban and rural. So
Mm-hmm.
if you look into both, there will be a very good hyper-local game along with the referral segments which will be going on, which involves once again the general physicians and the patients and other aggregators in that sense. So, if you talk about the urban population, obviously websites, marketplaces, lot of informations, lot of lead generators. But once again, if you try to balance it with the rural healthcare scenario, you will have to have a good mix of referrals in terms of, because in referrals, what we have all seen and we will all agree, the conversion rates are pretty much higher, which in cases of leads or in case of websites has not yet been established to that extent, but they're all growing up, right?
Mm-hmm.
So it has to be a good solid mix of websites, online platforms, aggregators, along with typical field referrals in terms of from doctor to doctor, from doctor to client, from client to client. So it's like a mixed platform, and even in between healthcare various providers, like it might be a good mix between OPD clinics and the IPD platforms, super specialty hospital like ours. So it has to balance according to the geography, because in India, geography in healthcare plays a big
Big
predominant
role.
role.
Yeah. Hmm.
Yeah. So in which part of the country you are, typically, because you cannot just think about the urban setups and conclude this, but you need to have a proper balance along with the geographical location. So if the location is obviously urban, then yes, websites and lead aggregators. If it is semi-urban, semi-rural, a mix of both. If it is rural, then obviously the local segment along with the referrals will play a lead role. That is my understanding of the entire scenario.
Yeah, that's a wonderful take. I think the importance of geography, especially in healthcare, and generally, I think for any industry segment in India, it cannot be understressed at all. That's a great point. We'll come back to that later in the conversation, Dr. Day, because I think I do have some follow-up questions on that aspect. But Azmat, I think this is a good part for us to segue into what Tripop does as well. I think you are slightly different. You're not on the provider side; you're more on the devices side, but you do provide certain infrastructure and equipment for the healthcare industry to thrive. And I'm
Right.
sure you do a lot of demand gen and B2B campaigns out there as well, right? So what's the one sort of B2B play or the one ABM play that you've always seen deliver high quality leads for you? What has worked for you in the B2B segment? Because it would be very different from what the other two
You're right.
gentlemen are talking about.
Absolutely. So, and I see this has been one of the topic that most of the people have been discussing for a long time
Mm-hmm.
about the B2B play and healthcare, and it's quite different when it comes to messaging and engaging with your healthcare professionals itself. So we generate most of our demand as Ashish and Dr. They also said through digital media itself. That has been the major chunk where we get majority of the engagement. And when you're also segregating between urban and the rural population, we have most of our engagement coming in from the rural population. I mean,
Right.
if you look at the engagement in tier 2, tier 3 cities, we have a lot of engagement that we drive through digital media than any other channel. So we had a limiting belief that, in B2B marketing, we just have to, be traditionally marketing and reaching out to the the target customers on ground through events and organizing more of the CMEs type of engagement events to reach out to the HCP. But what worked for us in the past 2, 3 years has only been the digital media. That drives consistent demand, and we push them through the journey through the nurture funnels and multiple hyper personalized messaging that happens through the platform. So the orchestration, everything is all only on the digital play itself. So we have a correct mapping from MQL to SQL to closures, and that's how we track it to the revenue part. So that's how we are a little different. So as I said, see, we are the provider side. We basically are a B2B to B2B to C kind of a play. So we are a impact business where we try to empower the healthcare providers with the early detection of the heart attack. So we detect STEMI cases within 10 minutes through remote cardiac diagnosis solution that we provide. So that is what we sell. That's the niche that we're into, Sridhar.
Got it. Thank you. Thanks, Azmat. So coming back, Ashish, I think there's one aspect what Dr. Day brought up of rural versus urban, right? Now, there is also different mix for especially healthcare provider segment like IPD versus OPD, micro specialty versus, let's say, a macro specialty. You have certain, there are various themes that exist within the provider side itself. Do you do different things across different channels and how do you control this sort of acquisition mix? Because obviously there is a segment which is only OPD. There's a segment which you want to direct from OPD to IPD. There's a segment which is pure IPD, right? So how does that reflect in the marketing channels and marketing engagement that you guys plan out?
So OPD generally is a one-time activity, and we assume that OP to IP conversions will rely on the doctors. Versus an IPD, which is a slightly longish cycle, especially in case of elective treatments. And those elective treatments can be, except for neurocardio, most of it is elective, be it orthopedic, be it, we also run a slew of IVF clinics by the name of Birla Fertility and IVF. So there is again a longish conversion journey, longish decision-making cycle, and which is where being connected with our leads, or say a qualified lead, which and the first level of qualification of which happens through our contact center, and being connected with them, being engaged with them at all levels of the journey becomes very important. And also in case of multi-speciality setups, for example, in obs and gynae, so there is a 9-month prenatal journey, and then there is a 2-year postnatal journey. So being connected with the consumer at every step of the journey of their child and their right from birthing to growth, and making them aware about different nuances. So both from pre-IP to IP to post-IP. So it is not just about pre-IP and nurturing them and providing information, best practices about success rates, etc., to post-IP, knowing about their well-being and also pushing them a wellness message, or say even a vaccination journey of a child, etc. So this is how we kind of look at IP as a segment. And especially in cases wherever there is a elective surgery or a treatment available. In those cases, even for enhancing connectivity, even for enhancing our connectivity through the call center as well, there is certain amount of nurturing which is required for these leads. And post nurturing, once the nurturing happens, knowing about their problem areas and customizing our communication and segmenting these users into different micro segments. And that is how we kind of keep in touch with our user base and ensure that they get whatever they are looking for, and they get a personalized and personalized clinical excellence which is available available through us as a healthcare provider.
Got it. Got it. No, that's, I think, again, very interesting point when you raise the concept of multiple touch points that a patient actually goes through before or while they're engaging with the hospital, right? So on the same lines, Dr. Day, a quick question to you on, I'm assuming you also have certain teams and a flow for the patients and the leads that you might be looking at across different organizations or different specialties, right? So when volumes are high, you really have to still keep a control on the operational aspects of what you're doing from a marketing perspective, because you've done all the hard work, you've got the right messaging, you have advertised in the right channel, and the person has actually either called you or visited your website or come to your clinic, right? So how do you ensure that there is no slippage that happens between marketing to, let's say, call center to front office to doctor to postdoctoral treatment and all of that? How do you ensure that there is no slip that happens? Do you have any metrics that you track? Are there any systems in place? Maybe you can walk us through that.
Yeah, see, almost all super specialty hospital follow the same metrics in terms of OPD management, in terms of arresting the slippages. But
Mm-hmm.
still, slippages happen. That's a reality. Yeah, but you have to cut it short because otherwise it also hampers the patient's journey somewhere.
Yeah.
Because we all serve an objective of treating the patient because whatsoever sort of marketing you do, the best marketing is by healing a patient, and if by touching a life you can spread the awareness to five other lives. That's the thought
Yeah.
and the belief that we all will agree to. Now, in order to that, we have customized the journey. For example, if there are any online leads, we try to segregate it. We have a fast forward mechanism for enhancing billing, because billing is where the stuck up happens in most cases, because in healthcare everybody has a priority, because the patient comes from various sources, but they will all like themselves to be prioritized, because obviously because they have different reasons and they have different physical concerns.
Yeah.
So giving a priority to a patient in terms of billing, in terms of showing to the doctors as per availability, and in terms of making the journey more easy and seamless, like just now Mr. Ashish stated, by giving some reminder messages on call, and so that he does not forget, or the patient does not forget certain things or investigations. And end of the day, this will all see. End of the day, the entire ecosystem will allow you to control the seepages. There cannot be a single mechanism, but it has to be the entire ecosystem. Doctors have to be sensitized. The leads have to be fast tracked, which we all try to do. I believe all good super specialty hospitals of a sizable
Yeah.
dealing with a sizable volume. Matlab, we are all catering to nearly per day, nearly 400, 500 OPD patients. That's a large number.
Yeah.
So in that scenario, if you do not prioritize, if you do not take care of the patient, and if you do not attend to turnaround time, tech plays a major role in this,
Mm-hmm.
because anywhere you will see that from the patient walking in to the generation of token to the patient walking out post a pharmacy billing or post availing a test, if that time span exceeds a certain time frame, supposedly if you are there in a hospital OPD for more than 3 4 hours,
Mm-hmm.
obviously it does not lead to good conversion. So all this needs to be controlled within a certain turnaround time. So a tag mechanism in every sphere, be it billing, be it from billing to showing it to doctor, be it from token to billing. So if you define a particular tag in this, and if you are able to control the tag, only then can you arrest the seepage. That's my understanding.
Yeah, I think, and speaking from personal experience, I can say that hitting the billing in OPD is still usually okay, but as an IPD, when you're doing your insurance and your billing process, is possibly one of the most friction-full processes in a in a healthcare system today in the country. Anyway, I have a follow-up question to both of you, Suman and Ashish, before I come to you, Azmat. Is both of you mentioned about giving reminders to patients, timely reminders, whether it's messages or phone calls and all of that. Do you see AI elements playing a role in all of this? Do you see voice bots maybe dialing your patients in the near future? Do you see AI systems reaching out to them? Any point of view on that? I know it's a little experimentative for healthcare, but any points of view, any experiments?
So generally, AI systems and voice bot healthcare is very different. It is when we talk about voice bots reaching out to people and talking about people's health.
Hmm.
Uh, though I haven't seen it getting experimented in any of the hospitals, except for the cases where it can apply to is just the service part of it, wherever you are just asking for your report, making it easy and seamless, and
Hmm.
having the agentic workflows in the background, which actually makes the user
Maybe
experience
reminders, appointment
very
reminders.
easy, giving reminders, etc. So these can be done by AI, but not the first level of conversation,
Of
because
course.
there is a certain amount of emotional connect which has to be done, understanding the customer's psyche, their state of mind, and then actually proposing them a clinician or recommending them a doctor whom they can connect to or consult with. So that is something that would always, which will always have a human part of it. But then there are transactional things which can always be automated. It can be a voice call giving them reminders of the appointment, and probably post-op also. There are certain reminders doctors write on the prescription that visit after 7 days. And with the advent of EMR, etc., in most of the hospitals, all of these things can be automated. That an auto call reminder gets set up that, okay, tomorrow you have to visit the doctor, and if you want to book an appointment, press 1 or 2. If there are limited slots available, if there is a walk-in available, that's perfectly fine. But and when it comes to messaging and everything, so right from content creation, right, be it video, image content, or a textual content, because this is where AI can be leveraged a lot to actually connect with the patients and connect with the right data. And on the third part, so these are on the communication side. There is also on the hospital side, there is a lot of use case. For example, discharge summaries. Writing discharge summaries is an exercise.
Yeah.
So the AI engine can sit on the top of it and actually write a discharge summary, which somebody obviously will validate. So this will reduce the cycle time of people who are actually picking up and writing up everything end to end. So whatever you need to change, you change it. Otherwise, if you're fine with whatever AI has given to you, then you can always post it and finish the work, especially things at the nursing station, etc., which are very, very transactional, can be done. But that is more on the HI side. From a patient standpoint, even for a discharge summary in hospitals, you have to wait. For an IP patient, they'll say, oh, discharge summary is getting prepared, you have to wait, and then we'll give it to you. It'll take 15-20 minutes, even after insurance clearance and everything. So
20
all of
minutes is
these,
being very aggressive, Ashish.
yeah, all of these can be really automated, because these are not the places, these are very transactional jobs. So many of the transactional jobs can be automated, both from a communication standpoint as well as hospital standpoint. But wherever there is an emotional touch point and a touch where a human touch is required to interact with the patient or slash user, that cannot be taken out by AI.
Got it. Got it. Cool. Thank you. So yeah, Azmat, coming back to you, I think there was something we were talking about, awareness and scale and all of that when it comes to the healthcare segment. Right now, Dr. Suman and Ashif has spoken from a provider and a hospital perspective on what is important for them in their outreaches. But in the B2B space, I think, especially for a company like Tricog, which I know while you guys have done brilliantly well, you're still relatively new, or you're still in the nascent stages of growth from an organization perspective, right? So how do you
Yes.
prioritize the spend between awareness and, let's say, actual sale? How do you brand building, right? How do you prioritize where you spend the money between awareness and ABM, or awareness and deal closure, right? Maybe
Right.
talk us through a little bit about that.
So good question, Sridhar. So every marketeer's biggest nightmare is the budget cuts. So
Yeah.
and that does happen. As marketeers, we always look at cutting in a lot of money and spend on the brand awareness itself, because every healthcare product that be it a medical device or an equipment that is needs to be sold to our end users requires a lot of education. Now, that education, because of the digital media, as Ashish was also saying, like it's very different, right? So digital media and AI helps us create good content. Content creation, be it image or be it video content or written content, that helps us scale a lot of these pieces without spending too much money and hiring fancy agencies and doing influencer based marketing and all of that. So this is how we cut budgets. We bring in a lot of AI elements into creating our content, and there are a lot of these research papers which we use as a lead magnet to attract the relevant HCPs and bring in more engagement. So and I said, like, the traditional way of marketing and reaching out to the doctors and the decision makers were all go knock the door and sit there for an appointment. Now that is the game that has changed because of the The pandemic and post-pandemic, everything is all upwards, be it brand awareness or closures of deals. Everything happens heavily dependent on digital media. And of course, the creative element there contributes to everything that we do as a central element of marketing itself. So that's how I would sum it up. So for brand awareness, I would say we always have a campaign which is running with a proper cap. There is a capacity that is added. And for the rest of the thing, we measure all the metrics, and the only metric that we measure is the revenue that is bringing. So we have a marketing-led revenue attribution that we take, and that's how we look at MQL, SQLs, and stop chasing the vanity metrics.
Okay. I won't get into attribution questions because
Yeah,
the entire conversation will go. We will waste half an
yeah,
hour
yeah.
thinking who was attributed to which lead. Okay, so let's not go there.
Sure.
But interesting point again is, we've just spoken about AI and content and creation and all of that. So one question as marketers we all face, it's very easy to create educational content using AI. Okay. But the minute you have to create content which has to get ranked on SEO, which has to get ranked on whatever PPC, and it has to go out there, this is still some stuff that is in discovery stage today, right? So any views on that? I mean, any of you can pick up the question and run with it, but would love to hear what your experiences have been on using AI to create content which has to be ranked. And how is SEO versus generative engine optimization or whatever you call it, how is that impacting the work that you guys are doing?
So basically, on a written content side, what we do is we generally haven't done anything on the SEO side. I mean, AI produced content does not rank on Google, and Google has rolled out the updates, etc. So we haven't really taken chances. What we have done is, instead, for generative engine optimization, we have kind of optimized our website and put it in a more and added FAQs to multiple pages which are ranking. And within FAQs also, there is a way in which you write the content which helps you rank on generative engines. And basically, it has to be a context, and the answer has to carry the context of the question, which is how the LLM engines read it.
Correct.
And also you have to follow the best practices of SEO. That's how it is, because whatever ranks higher will be picked up. Now, having said that, on the SEO side, definitely content writing has not been the piece, but on the video making side, YouTube SEO is also a large piece in healthcare. I mean, the moment you go to selecting a hospital, there are many people who would actually go to YouTube and search about those ailments, or on YouTube as well, treatments as well. So which is where these the tools like VO and Flow, which are apparently an off a sub part of Gemini on Google. So they make 8 second videos, and you can just integrate these videos and create one larger video of, say, 3 minutes or 4 minutes. But apparently, the cost of 2D video making and cost of informational video making, which you put on a channel like YouTube and which you can utilize in your customer communication as well, has gone down.
Yeah.
And even you can use those real life images, etc. While I would still say it is 90% accurate, but the overall turnaround time has come down. The overall effort has come down to make a video, and also a larger piece is that there is a little amount of editing which is required. Otherwise, it is just a combination of all 8 seconders, and you are able to create a good video output. So that way, from a YouTube standpoint and YouTube SEO standpoint, you can still generate a content. But from a written content standpoint, AI as an engine would not serve as a platform which will give you a content which will get ranked by Google in near future. Because and lastly, as I said, we have to adapt our website and our content to AI, and that's the way we have gone about it.
Got it. Got it. So what I'm hearing is you can use AI to enable faster turnaround of content, but to create actual content, whether it is scripts for videos or whether it is actual articles, that still has to be largely human driven, maybe AI supported, but largely human driven.
Yeah,
Right? So
video scripts can also be created through AI, and you can
and
create
that
videos.
ranks, huh? That ranks on SEO. That's a
Yeah.
strange one. Okay. Anyway, so Dr. Dey, then coming back, with all this AI stuff happening and everybody's inbox getting flooded with a lot of content, I think personalization and talking to the customer in his language at the right time, at the right channel for him becomes very important, right? So Can you talk me through some of the stuff that you guys have done at your hospital to design communication journeys that are still empathetic to the patient, that are still personalized to them, and that maybe still deliver high recall value as well as high retention from from your patients? Would you like to talk through some of the initiatives at your end on that?
Yeah, see, right now, if you are talking about ATL and BTL activities, all
Hmm.
the hospitals nowadays try to simplify the language. See, AI will not simplify the language. The customer will understand a regional, very small term. Like if you
Hmm.
say that MICS, minimal invasive cardiac surgery, which is the latest in cardiac surgery, you will not
Hmm.
understand the thing. But
Yeah.
if you say that it's a bypass with only a 4-inch cut, like,
Hmm.
right? So even, and if you just translate it in a regional language, then he will easily understand.
Hmm.
Yeah, so it has to be a very careful mix of content. Here, AI will not lead to that as of today because see, this is all science driven and this is all very technical. It cannot be made lucid till to a certain extent. The indication cannot be changed, but it cannot.
Hmm.
It can be translated to a local language. It can be made into a 2 letter or a 4 letter word or something which is easy for the customer to understand as per the indication which to which the customer will relate to in the long term. Right.
Understood.
So you can,
Understood.
yeah, so you can understand it from the service angle and see, end of the day, what is the objective you want to serve? You want to spread the awareness on one hand, because obviously there has to be awareness. Otherwise, your footfall will get stuck to after a certain level. So the awareness is all related to service aspects.
Hmm.
It is all increasing. Like in non-invasive cardiology, if you nowadays say ECG and echo, everybody is aware of that. So you have to say something else, adding to the array of services like head-up tilt table, a HOT, which is a new one, relatively new one in this. Stress echo, which is relatively new one to this, but
Hmm.
adding to the entire array of services. So that the customer, once that customer enters into your, see, end of the day, as I said, the objective is to treat the patient and to treat the patient well,
Hmm.
um, so that you can touch the life, you can increase the longevity, and end of the day, the patient goes back with certain solution. So if
Right.
you can provide the complete array of services in a lucid language, and you can portray it in what sort of, either you are campaigning in digital media, or you are campaigning outdoors, or you are reaching to the doctor's chambers, there are certain modality every marketeer will follow. So
Right.
end of the day, it reaches to the end customer in a very lucid form, and he will understand that this is why where I'm leading to. For example, the new thing is robotics and AI-driven surgeries. We are all seeing advertisement all across about AI-driven surgeries, which will in future add to the precision also. But end of the day, if I'm communicating to the customer, so I have to tell him that how he will benefit out of this,
Correct.
because immediately I do not communicate. The immediate innovation is that it is going to be hugely costly,
Hmm.
right? So there are certain innovations which are playing in his mind. So my communication needs to address the innovations which are playing, and which immediately AI will not sort out. But AI is doing great stuff. I will agree. It is a thing for future. But immediately, since these are technical things, we have to convey it very simply. But we can add AI tools in that. And AI, as we have seen in the field of medical science, in the field of communication, is doing wonders. It's a thing for future, and we all need to adapt to that and look forward to that.
Yeah, well noted, sir, on the point of simplifying messaging, because from a very long ago personal experience, there was, I think, at some point the knee replacement became a minimally invasive surgery, right? But the term that stayed in my mind is keyhole surgery. It's just simplified. It's just the size of a keyhole, right? And that's the term that sticks with you. So carrying on the whole simplification of communication process, Azmat, uh, what kind of creative messaging or what kind of channels have you chosen in tier two and three markets, right? What have you found effective? What has worked for you guys? Maybe you can talk us through a particular instance or a particular project that really helped you see a surge in in demo requests or whatever metric it is that you track?
See, as I mentioned again, tier two, tier three has a lot of consumption of the digital media itself. So,
Right.
um, and my team actually was brainstorming with me on the outreach of how do we get maximum outreach. We strategized a hyperlocal engagement program with a planned CMEs across the tier twos. Um, and at the same time, we had the awareness campaigns which were running on, Meta, that's Facebook and Instagram. So we were all the belief that Google is a place where people actually come with a high intent and all of that, but that campaign alone proved us wrong. So that experiment worked for us somewhere 2 years ago, and we are still strong with the penetration in the tier two, tier three markets. With the Meta itself as a strong communication channel for both brand awareness as well as the conversions. So we are slowly kind of cutting down our budgets on the hyperlocal activities, on ground activities and conducting CMEs and events because the education is happening more, uh, in a very, very, detailed manner with the engagement on the digital platforms itself. So we orchestrate all these journeys with some of the case studies and share some of the testimonials of the people in the regional language and the real life incidents that is helping out. That's how our solution is helping people to save their lives. We have basically done about 28 million diagnoses so far in our journey. Um, with a record turnaround time of reporting the critical cases in less than 10 minutes. So that's our promise. So that's the kind of work at scale that we've been doing so far, and that when spoken about the impact. So we have younger population which is all falling prey to the sudden cardiac arrest, and all these problems are on the rise that get spoken of very frequently in the media as well. So we look at these things in the recent event that happened in Karnataka state itself, produced a huge demand and surge on our traffic, as well as the inquiries that came into with a proper intent, and that is where we kind of we are available there with the right content at the right time. So that's how the entire engagement for us, the warm engaged leads come in, and that goes into our funnel. We have our inside sales team which qualifies each and every one, and we fix these demos that way onwards.
Got it.
So that's how we do this, Sridhar.
Got it. Got it. Interesting, Azmat. And I think you again touched on a good point. And I think I mentioned at the start as well that obviously the healthcare segment sees a lot of demand. There is no dearth of demand that we know. And there are a lot of clinical and health outcomes that people desire, right? So there is something that is being constantly spoken of by the marketing teams as well. But in terms of the marketing metrics itself, so maybe Ashish and Dr. Suman, this is towards you guys. What kind of marketing metrics do you actually track within your segment that connects to business or clinical outcomes, right? I'm sure there are, for example, in the world of SaaS, we look at certain LTV and CAC and all of that. I'm sure you have certain similar terms in your side as well. What is it that you guys track, and how are you trying to refine these on an ongoing basis?
So generally, the marketing metrics we track is because we are a B2C business, so we would always look at the cost per lead.
Yeah.
And then once we look at new footfalls as a healthcare provider, because repeat footfalls are a function of a doctor and our hospital facility.
Right.
So generating new footfalls is the job of marketing, while repeat footfalls, etc. I mean, there is some amount of CRM and awareness that we run for repeats for chronic diseases, etc., which is a different story altogether. So that
Right.
is on the repeat side. On the new footfall side, we look at cost per lead to footfalls, and OP to IP. So in general, and for an IP, it is always 6 months revenue rather than in-month revenue, because most of these elective surgeries, if you look at TKR, the moment OPD happens, there is certain amount of, obviously there is an examination, and then initially unless and until it is 80-90% of a damage is already done, there would be a certain resurrection path which generally the clinicians clinicians provide, and then they wait for some time to see that whether things have fallen in line or not. Otherwise, they would go to a different treatment regime. It would involve surgical procedure, etc. So, which is where it is a 6 months window of a customer wherein either he would convert to an IPN order, and even in cases like maternity, etc. So these are the metrics that we generally look. Yeah. Otherwise, there are other healthcare metrics, which is more of an operational matrix like average revenue per occupied
Those are
bed, etc., which is different. But from marketing standpoint,
Which
it
is
is
different.
always about CAC, LTV over a period of 6 months, and LTV by CAC ratio for a period of 6 months, what we have achieved. So that would be for me. For repeat, it is generally our CRM spend versus the repeat rate, what we have been able to do. It's only in the chronic segment. For all other non-chronic segments, of course, it is always about the doctor will say that, the clinician would say that, okay, visit after 2 months, 3 months, and all of it, and it would be a part of it.
Got it. Interesting. Any metrics that are misleading according to you for the segment, which people should probably not be tracking, or anything which, let's say, a certain ratio that can be misleading that you guys have observed?
Not as of now. I mean, while I was in travel, generally, healthcare has got a lot of limitations in advertising. You can't really subtract the people who are already in your pool,
Yep.
especially on a platform like Google. So, which is where one thing which is misleading when you are generating leads, say from Google or your obviously is organic. So, is basically your cost per lead is a blended cost of new and the repeats. But you want to target new, you don't want to target repeat, but Google would not allow you that. So which is something that, though it's misleading, but then you can't avoid it because the ecosystem is made that way.
Got it. So the imperfection is sort of built into the metric itself. You can't do much about it. Okay. And Dr. Dey, in terms of, we spoke about CAC and LTV and metrics, etc. But how do you, as marketing, what is it that marketing can enforce or put in practice so that a one-time admission is more of a long-term value for the organization? Now, I understand it is a tricky part in the healthcare business, because ideally, if your outcome is good health that you want to drive, then ideally you don't want long-term value and repeat customers. But it is something that is the nature of the industry in itself, right? So how do you strike that balance between communication and turning a one-time admission into a long-term value for the organization?
See, if we are considering the patient acquisition metrics, then obviously it has to be a clear-cut balance between the PAC, that is the patient acquisition cost, and the patient lifetime value. So we all calculate PAC in whatsoever forms, apart from very organic ones or walk-in ones, and we all calculate the PLVT in terms of patient long-term value, in terms of the total revenue the patient will like to generate in the entire life cycle to the organization. So these are all internal calculations that requires a lot of balancing. And definitely from the organic source, the thrust should be more on the organic source, because you can understand that end of the day with the organic source, you are catering to a greater number of patients, and there is more probability in that patient returning or adhering to the therapy in the long term, which also benefits the patient or the families, because then the outcome or the probable clinical outcome aspect is also taken care of. So irrespective of what matrices we follow in terms of PAC, PLVT, or other matrices, there are various key matrices which ultimately leads to the ROI part, because every hospital is calculating that, and end of the day, it's all a game of ROI, EBITDA, a lot of LOS, RPOB. So we all have a different set of calculations into that, but it needs to be a good balance so that organically every organization is growing, and that organic growth will lead to a good patient experience, a good patient journey, and more of that will lead to a good patient number or a good volume to play with. I think that's a key aspect of how you balance, because I can tell you 10 matrices, but that will differ once again from geography to geography or from organization to organization. That is the point that I started with in the first place, because the beauty of hospitals are that every hospital has a different organic structure. So see, in our segment there cannot be copycats. Somebody is addressing or somebody is catering to the LIG community, somebody is catering to the MIG community, somebody is catering exclusively to the HIG community with state-of-art facilities. Like for example, nowadays a cath lab is costing lesser than a CT scan. So there is an advent of cath labs all across the nation. So it depends on the type of facility. What is your vision? Somebody is cardiology oriented, somebody is IVF or fertility oriented. So the vision of the organization, the type of geography you're located in, and that matrix should be developed according to that. It should be customized. The end point that what I want to address is that you can have 20 key defined matrices, but in order for all of them to come to or accumulate to the ROI or to reflect in EBITDA, it has to be customized as per your geography, as per your vision, as per the population that you are catering to. Only then you will succeed by following any metrics.
Got it. And I'm just getting a reminder, we are sort of down to the last 5 minutes. Maybe a couple of questions each, Azmat and Ashish. Ashish, first you and then Azmat. Just a quick one. Beyond digital, there's referrals, there's community, there's on-ground engagements, and Dr. Day was also mentioning about rural and tier 2, tier 3, tier 4 towns, etc. In the offline space, what is it that is scaling from a marketing perspective for you guys? What is doing well? Where are you seeing good responses? And of course, being users of Lead Square, you're tracking a lot of this through the platform as well. But what is it that's working for you in the offline space?
See, in the offline space, typically healthcare as a segment, because we just don't have our hospitals in the metros and tier ones. Even our clinics are in tier 2, tier 3 towns. So on ground, there is a lot of walk-in behavior apart from metros, which is non-appointment based. And there is also a lot of referrals which come in. One is, of course, being in touch with your patients, and until and unless and providing the quality of clinical care is not just the clinician addressing the problem. Anybody who comes, I mean, in healthcare, nobody wants to go to a hospital. Nobody wants to fall sick. I also don't want to fall sick at any point in time.
Yes.
So it is not a choice, but it is a need. So addressing that customer and being with them right through every stage of the journey. And as Dr. Day also pointed out that even right at the counter, and there should be somebody to guide you and also to help you throughout the journey. So there is always a counseling team on the ground which actually does this job. But for them, that data to be available, that who is the patient, who, if there is a walk-in, if somebody has been recommended a surgery, they are not in a very happy state of mind. Nobody wants to be operated. So which is where at least, and if they have to kind of figure out things themselves on the ground, and also figure out calling 10 people that how is my insurance going to work. So somebody has to be there at every stage of the care journey. And for that to be there is an information which has to be readily available for the people who are tagged to one person. If there are 20 patients tagged to one say even a coordinator or a counselor, so the information has to be available on their handheld, which gives them all the information where the stage is, so that they can assist the people correctly and also assist them in the rightful way, so that I mean, a part of the recovery is also a part of the overall experience and overall de-stressing kind of a scenario that you provide to the patients or their attendants. So which is where there is a lot of technology at play and automation at play, which comes to the counseling bit. And on the referral side of things, even if, I mean, when we talk about experience, it has to be a great patient experience when a patient walks in. And when I talk about great, it is not about, I mean, unlike in e-commerce or a travel where we used to talk about absolute customer happiness, we want to create happy patients who go out and recover well. And also being with them at every stage of the care journey. So when a person is referred, if he has to come to our hospital, figure out things, I mean, nobody to tell them where to go, what is the appointment time, etc. So having all of that automated in a system wherein one is, of course, we have got an application wherein all the referrals are reported and they are able to get to the right people, right platform, spend the least amount of time waiting, and they get to the clinician. The second is, even during the IV procedure, there is certain amount of counseling, help, information which is required, handholding which is required, which is done by a person, and that person knows which are the people he has to address during the course of the day and what he has to address to them. Both these things, if it is available, it makes the overall journey very frictionless.
Yeah.
And because the person who comes into a healthcare facility is already under a lot of stress, a lot of emotional changes that is going on in his or her mind. So, which is where, as a healthcare provider, our job is also to ease out the journey. And that is also a part of overall, not just experience, part of the healing journey as well.
Yeah, agreed. Because
So
nothing is more
technology
frustrating
plays a
than
very large role where you provide information to all the stakeholders in the journey right when they need it, and they know what to speak, when to speak, what are the problems which a patient is facing, and all of it, and be sensitized and be with them at every stage of the journey.
yeah, because nothing is more frustrating than walking in there and not having people tell you what is required, right? I mean,
Yeah.
that's quite frustrating. And Azmat, just putting you on a bit of a spot here, let's say, and as heads of businesses and CEOs really like to do very often, you have the same budget, but you have to double your leads, right? So, faced with this challenge, what is it that you would look to today? I mean, what kind of systems do you think can actually drive that growth in the near future? And this is the last question. Post this, we'll see if we have any questions from the audience and take that up. But yeah, if that's the challenge thrown at you, what would you look at?
So the only thing that we can look at as marketeers with a constrained budget is double your organic
Yeah.
leads, and work on the loyalty, get the referrals, because I believe strongly, as you all know, one loyal customer is better than five new customers. So that's what we work towards. We have a fantastic team which actually does that work in the
Mhm.
customer marketing side, where we track their usage, their behavior, their relationship. We solve the problems through the customer success. Build a good customer success team when you're in the B2B business, and that leverages overall and helps the growth marketing teams to stay, EBITDA positive and cash flow positive as well. So that's what I would say.
So funny, right? If you have a good product and a good experience given to the client, that drives organic traffic, which increases the free business that comes your way. But somehow
Yes.
the pressure is always on reducing the marketing budget and not improving the product and the experience. I mean, that's just a pet peeve of mine
No,
about this space. But yeah,
yes. The answer is, we always look at two departments that are most crucial for any organization or the growing business. One is marketing, and second one is the innovation. So
yeah,
without both of them together, it's always there is a slacked growth that will never happen. So, and sales is not a part of that. So we all drive the strategy, and after that, the sales basically takes over everything from there. So that's how we can stay within the limits of the budget and play this game, Sridhar.
okay, cool. I'm going to put all three of you in a bit of a spot and ask you a few rapid fire, two, three questions, maybe a couple of word answers, not long ones, please. So
Sure.
while it's very difficult to do, please stay concise. And let's go alphabetically. So, oh my God. Okay. So then Ashish is first, then Azmat, and then Dr. Day. Okay. So Ashish, one thing you'd stop doing in healthcare marketing from tomorrow morning.
I cannot think of it right now.
Okay, we'll come back to you. Azmat, something that you'd stop doing.
Chase vanity metrics.
Vanity metrics. Okay. Dr. Day, something that you'd like to stop doing in healthcare marketing from tomorrow morning.
Stop chasing inorganic growth in any form.
Fantastic. Okay. One metric that you'd want on your dashboard every day at 9 a.m. Dr. Day.
I am a big lover of the revenue metrics. Every day, 9 a.m., I love the revenue metrics. And since I am from the hospital industry, I also love the occupancy metrics.
Got it. Azmat.
Same revenue. I agree with Dr. Day. Absolutely.
Okay.
I love
Ashish.
revenue. Marketing should impact revenue. Yeah.
Ashish. Same
Revenue
answer.
and new footfalls.
Revenue and new footfall. Okay. That's very interesting. One emerging technology, I would say not trend, let's say one emerging tech that you think will really reshape marketing in the coming 5 years. And AI has emerged. Okay, so let's not talk AI. That has already emerged. But what else do you think is out there in the next 5 years?
Patient 360-degree view and analytics over it.
Okay, Dr. Day, one piece of tech that you think will change healthcare marketing in the next 5 years.
Oh, I don't know. I'm still stuck up with AI. I'm still amazed with AI. And I don't think that we have yet achieved much of AI. So AI will remain.
So the vote
Yes.
stays with AI.
How
Great.
it-
And how about you,
yeah.
Asman?
I'll agree with Dr. Day. I guess AI has a lot of potential. Agentic flows is something that will help marketing big time.
Okay, cool. Thank you so much, gentlemen. That was a really nice conversation. I love the viewpoints shared, and I hope it was as much fun for you as to me as well hosting it. Ashna, Anjali, if either of you is online, do we have any questions from the audience that we need to address, or we are good?
Yes, Sridhar. Most of the questions we have already covered during the discussion, but
Okay.
we've received a couple of questions that I think the panelists can chime in. First up, Vatsala wants to understand how can healthcare marketers convert inquiries into patient trust in walk-ins when call center staff aren't very skilled. This is something which we've covered, but maybe Sridhar, you can chime in for this follow-up question, which is, and how does Lead Squared bridge this gap?
Okay, I'll ask Ashish to pick this up. He's a Lead Squared user. He has a call center and he knows how to do this. You want to jump in, Ashish? I don't want to make this a sales pitch of a call, but please go ahead.
So we utilize Lead Square right from when a call comes in or a lead form gets filled. So right from utilizing it as a lead management system to prioritizing the leads for our contact center agents, when to call, to managing their tasks on a daily basis. So looking at their task management in terms of when they need to call, and if there is a callback that needs to go to at a certain point in time that has gone or not, to kind of looking at the entire marketing module as well, which means that micro segmentation of leads and connecting it with a CPaaS platform to be able to reach out to our patients slash customers. And on the other side, we also use the counseling and the operation module to be in touch with our patients throughout their care journey. And this is where Lead Square acts as an enabler for our on-ground teams as well, and also utilizing it for our field sales team as well, in terms of looking at their and looking at it as a field force automation tool as well. So we have been able to leverage it in a 360-degree manner, right from a B2B and a B2C perspective as well, and even from a lead conversion perspective as well.
Thank you so much, Ashish, for the kind words. Good to always hear from a customer. I think, Ashna, with that, we should wind up. We only have a minute left. I'd like to give a minute back to our audience and the speakers as well. Once again, Azmat, Dr. Day, Ashish, thank you so much for joining and taking time out. It was a great pleasure to
Thanks.
meet you, and I hope to be in touch with all of you.
Thanks, Sridhar.
Thank you so
Thanks.
much. Thank you.
Thank you. Bye-bye.
Thank you.
Thank you
Thank
so
you,
much
everyone.
for joining.
Bye-bye.
Yeah.